Welcome to the MamasteFit YouTube channel. In this workout, we're going to be doing a pelvic stability workout that is going to be targeting the SI joints or the joints on the backside of the pelvis. This workout is great for both pregnancy and for postpartum, or if you're outside of that phase of life altogether. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and SI joint is something that I tend to struggle with a little bit more during my pregnancies. However, pain is not a requirement of pregnancy, and so fortunately, there's lots of things that we can do to help relieve and resolve that discomfort that we're feeling within the pelvis. There's two main things that contribute towards pelvic pain. The first is our pelvic position, or how well do the pelvic joints align to themselves so they can form, close, or compress like puzzle pieces together to help stabilize. Normally, we have normal asymmetry throughout our body, even outside of pregnancy, but during pregnancy, these movements can become more exaggerated. So we tend to put more weight into our right leg, which causes that right pelvic half to shift backwards as the left half comes forward. This can also result in a rotation in the upper body as well, where we tend to be a little bit more compressed to the right side, lengthen in the left, and then rotated towards the right as well. And so because of that, this can sometimes cause a muscular imbalance, which could impact our pelvic position. During pregnancy, we tend to sink into these positions a little bit deeper because of the hormone relaxin, which increases the laxity of our pelvic joints and the joints within our body. And so during this workout, we're going to be targeting pelvic balance by addressing the different musculature that tends to be a little bit weaker or tighter on each side. Commonly, the right glute and quad tend to be a little bit weaker on the right side, while that right inner thigh tends to be tighter. While on the left side, the hamstring and inner thigh tend to be a little bit weaker, while that posterior pelvic floor and glute area tends to be a little bit tighter. And so in this workout, we're going to incorporate exercises that help to strengthen the weaker sides while also releasing tension in the tighter sides so that we can improve our pelvic balance. In addition to the position of the pelvis, there's slings of muscles and fascial lines that help to support the pelvic joints. In this workout, we're going to be incorporating the posterior oblique sling, which is your lat to opposite glute, which crosses just above the SI joint to help stabilize it by compressing with forced closure. So this means the muscles that support the joint is closing it or compressing it together. If you want to dive into more exercises to help resolve pelvic pain and to stay pain-free throughout your pregnancy, check out my book, Training for Two. Training for Two is all about how you can use prenatal fitness to support a strong pregnancy, a pain-free pregnancy, and also to help you prepare for birth. In the book, we include pictures, written descriptions, in addition to QR codes to videos, breaking down different exercises that you could do and the why behind them so that you can learn how to apply movement to your pregnancy to support a strong journey. You can check out Training for Two down in the notes below. In addition to my book, you can also join our online prenatal fitness programs. We offer our online prenatal fitness programs in two main formats. The first is going to be our app-based program, which is going to be in the Team Builder app. It's a list of exercises with short demo videos that you follow at your own pace. So this is a great program if you're wanting to work out in a gym setting, work out with a barbell, and work out at your own pace, as it's a traditional style of workout delivery. That is the workout program that I am currently using throughout my fourth pregnancy and what we use with our in-person training clients here in North Carolina. If you prefer to follow a video like this as you work out at the same time, we also have our prenatal on-demand program. The on-demand programs come in three formats. We have our prenatal fitness program, which is going to incorporate strength and conditioning workouts, pelvic stability, and birth preparation. We also have our pelvic stability standalone program that supports just pelvic stability. And then we have just our birth prep program as a standalone program as well. You can check out all of our prenatal fitness programs on our website at MamasteFit.com and use code YouTube10 to get 10% off. For this workout, we're going to be moving through 5 movements. The first is going to be the squat with band and row. This is going to be our posterior oblique strengthening exercise to help with that forced closure where the muscles supporting the SI joint are improving in their coordination as they stabilize the joint. We're then going to move through 4 movements to help support pelvic balance. We're going to start with our half kneeling lunge, which is going to release tension within the inner thigh musculature. We're going to move to a staggered stance box squat to help strengthen the glute and the quad. We're then going to move down to the floor for an adductor side plank to strengthen the inner thigh. And then we're going to finish up with an all fours hip shift to release tension in that posterior pelvic floor. For this workout, we're gonna need a band attached around chest level for that squat with banded row. If you're using your door frame, throw your door anchor right around the doorknob. We're then going to need an elevated surface for that staggered stance box squat. You can use a chair, you can use your couch. I'm using a workout bench here. And then we'll need a yoga block for the final 2 movements. So once you've gathered your equipment, let's go get started with today's pelvic stability workout. So starting with the band in your left hand, we're gonna come down to a squat as we reach forward, and then exhale to row as we come up. So inhales to lower, exhale to row as you come up. We'll do 30 seconds with this arm, and then we'll switch to do 30 seconds with the other. So at the top, really think tucking that butt underneath to row that band back. And switch. Let's go ahead and move into our half kneeling lunge to release some of that inner thigh. So for a lot of us, the right side inner thigh tends to be a little bit tighter compared to the left. So just pay attention as we kind of move through this, if you want to stay on the right side or if you want to explore the left side. So go ahead and rock into that right side. So we're feeling more of that groin stretch here. So one of the things that contributes towards pelvic discomfort, and in the 3rd trimester, you may be feeling more discomfort within your pelvis, is one, the pelvic position. So how the pelvis is kind of aligned to itself can cause some discomfort. Go ahead and switch. And so for a lot of us, we tend to have some normal asymmetry within our body. This asymmetry is not normally problematic, but during pregnancy, these asymmetries can get exaggerated because we're kind of sinking into these positions a little bit more thanks to relaxin, which is a hormone that causes more laxity within our joints. Let's come to our staggered stance box squat. So we're gonna start with the right foot is gonna be my flat foot, and my left foot is gonna kind of stagger in front of me. So most of the weight is gonna be in that right leg. So in addition to the left or the right inner thigh being tighter, the right glute and quad tends to be weaker. So inhale to lower, exhale to come up. So most of that weight is gonna be in the right leg here. And similar to the half lunges, you may find that you wanna spend more time on the right side. So if you're having more pelvic pain, especially that SI joint pain, do the full minute on the right side, but you can also switch. So for this first round, I'm gonna do both sides, but for the second, I'm gonna focus on the weaker side. So switch to the left. So how the pelvis is aligned to itself can influence pelvic pain or stability. And so if the pelvic joints can't quite compress or fit like puzzle pieces together, it can cause pelvic pain. And so sometimes the reason that they don't fit well is because there's an imbalance with the musculature surrounding the pelvis. So let's come to the floor. Take our yoga block. We're gonna place it with the left knee on top, and that right leg is gonna come forward. And similar to the right side, the left inner thigh tends to be a little bit weaker. And so for this round, we'll do both sides, but for the second round, we're only gonna do for the left. So pushing the hips up, so you're feeling this all in that left inner thigh. And then if you want, you can pulse in that bottom leg, so the knee just kind of lifts off. So if we address the muscles that are weaker and the muscles that are too tight, It can improve pelvic balance. Let's go ahead and switch to the other side. And so remember, in round number 2, we're going to focus just on the sides that tend to be weaker for us. But if you're not having pelvic pain, you'll do both sides. Go ahead and lift the hips up. So I'm pressing through the right knee right now. And then I can pulse through that left knee if I like. So a lot of this workout is targeting balancing within the pelvis, so addressing the musculature that tends to be a little bit weaker or a little bit tighter. And now we're going to come to that tabletop position. So we're going to start with the left knee on the yoga block, and I'm going to shift my weight over towards that left side. So when I shift my weight over, I should be able to lift this right leg without really changing my upper body position because most of my weight is in that left side. So I'm shifting my weight over, and I'm going to drop the belly to the floor, and then exhale, pull belly to spine to round. So it's my core engagement that's rounding in my back. Inhale to lower. So we're going to spend a minute on this side, and then we'll switch to the right side. What this exercise is doing is it's targeting the posterior pelvic floor on that elevated hip. So for this side, it's on the left side. For a lot of us, we tend to have a little bit more tension to the back half of our pelvic floor, which could be like pulling the tailbone in one direction. It could be influencing sacral movement. Let's go ahead and switch. So shift to that right and then move through your pelvic tilts. And because of that kind of uneven pull in the back half of the pelvic floor, it could also be impacting how your sacrum and your SI joint can move or align to itself. And so remember, we're using that core engagement, pulling baby to spine to be what's helping us round in our back, not clenching in our glute. So now let's move into round number 2, which is going to be our final round. So we're going to start with that posterior oblique sling strengthening exercise. So this is helping to strengthen the muscles that come across that SI joint to help stabilize it. I'm going to start by holding the band in my left hand. Inhale to lower, exhale, come up and row, and really think tucking that butt underneath. So when I come up, I'm not tucking by arching or pushing my belly forward. I'm thinking like clenching my glute, essentially, to tuck the butt under. Go ahead and switch. So that posterior oblique sling is using a myofascial sling to help compress or stabilize across that SI joint. So essentially the muscles supporting the joint are pulling it together to stabilize it during movement. Let's go ahead and start with that half kneeling rock. For this round, we're only going to do the sides that tend to be a little bit tighter. So we're going to have that right leg out, and we're going to maintain that for the full minute. But if you're not having pelvic pain, you can do both sides. So begin to rock into that right leg and then come back. As you come out, you can kind of think like push the knee outwards or backwards. So for a lot of us, the right inner thigh tends to be a little bit tighter compared to the left. So go ahead and switch if you're not struggling with any sort of pelvic or SI joint pain. If you are having a little bit of tweakiness, stay on the right side. So for a lot of us, we tend to stabilize by putting our weight into the right leg, known as right stance. And we do this because the diaphragm's bigger on this side, organs are denser on that side, and so we just feel more stable on the right, which causes this hip to come into more internal rotation. So let's move on to those box squats. So again, starting with the right foot, left heel is going to come up. And now while I do this, for this round, I'm gonna do them all on the right leg, but if you're not having pelvic pain, you'll do both sides. And so because that hip is in normal, inhale to lower, exhale to come up. So because we tend to put more weight into our right leg, this brings that hip into more internal rotation. And so the pelvic half is kind of being pulled backwards and more internally. And so this causes the glute and quad to be a little bit weaker on that right side. So go ahead and switch if you're not having any sort of pelvic pain. If you are, stay on this right side. So inhale to reach down, exhale to lower, or exhale, come up. Let's go ahead and move to the floor now for those adductor side planks to help strengthen that inner thigh. So I'm gonna start with that left knee on top of the block. Again, we can switch halfway or you can maintain. We will have a 10-second break in between. So go ahead and lift those hips up, and then you can either keep that right leg down on the floor or you can pulse it. Keep pressing through that left knee to keep the hips lifted. Go ahead and lower the hips. You can switch sides. If you are having any SI joint pain, stay on the left side. So we got 5 more seconds here before we start again. Go ahead and lift those hips up. And then if you want to add a pulse, feel free. 5 seconds to go. Go ahead and lower the hips. And now we're going to finish up in that all fours hip shift. We're going to do the hip shift on both sides, even though for a lot of us, the left posterior side tends to be a little bit tighter. But for most of us, both halves tend to have a little bit more tension. So placing that left knee onto the yoga block, shift your weight over, and then drop the belly to the floor, and then exhale to round in the back. And again, with these exhales, we're pulling belly to spine, which is causing us to round in the back, not clenching in the glute. When the rounding is coming from the core, this is going to allow the pelvic floor to release and relax into it more than if you were gripping in your glute, causing you to round. Let's switch to the right now. So bring that block underneath the right knee, shift the weight over, and then drop belly to floor. Exhale to round. And again, it's the engagement of the core that is rounding your spine. So I'm thinking pull rib cage and belly, rib cage and pelvis closer as I pull belly to spine, not clenching in the glute. Thanks so much for joining us for this pelvic stability workout. I hope that if you've been having any SI joint discomfort, that it feels a little bit more resolved by the end of this workout. If you want more support throughout your pregnancy, be sure to check out our online prenatal fitness programs. Again, we offer it in an app-based format and as full-length workout videos like this, and you can use code YouTube10 to get 10% off. In addition to our prenatal fitness programs, you can also bundle them with childbirth education to save an additional 15%. So if you want to learn the science of birth, how to prepare your pelvic floor for birth, and all that good stuff, check out the online course and the bundles as well. If you enjoyed this workout, be sure to like and subscribe to our channel so you get notified whenever we release new videos. We release one new workout video every week and like 3 to 4 educational videos to help support your pregnancy, your birth, and beyond.